On today's World Insight, a California dock for a cruise ship. Why the struggle for the Grand Princess to offload ailing passengers? And first-hand experience in an epidemic. Hard lessons learned in the words of the China WHO Joint Team Leader.
Everything we've seen since leaving China is consistent with what we saw in the country and what one would expect. But it's very, very impressive, and it still is the standard for the rest of the world.
Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live on CGTN. I'm Tian Wei. Let's begin today's program with COVID-19 spread in the United States. At least 565 cases in 34 states have been reported. But many media reports also say the U.S. is not testing enough for viral infection. Meanwhile, another cruise ship, the Grand Princess, which has been stranded off the coast of San Francisco, will finally be able to dock today. Authorities mapped out a plan to treat those exposed to the coronavirus. Take a look.
The Grand Princess cruise ship that had been held off the coast of California after it was refused permission to dock in San Francisco will dock in Oakland Monday. There are 3,500 people aboard. At least 21 people are infected with the coronavirus. Passengers in need of hospitalization will be taken off first. The passengers will be quarantined in federal facilities across the country. Still, how quickly the passengers will be tested and quarantined was not immediately clear.
We are not prepared to tell you exactly when the cruise ship will come into the port, as we are still working out the enormity of complexity of making sure we prepare the site and, moreover, prepare for quick turnaround and quick boarding of individuals to respective locations.
As soon as the passengers disembark, the ship will return to sea, where the crew will wait out their quarantine. The government is warning those particularly vulnerable to the disease to avoid travel and places where people congregate.
Well, when I say protect, I mean right now, not wait until things get worse. Say no large crowds, no long trips, and above all, don't get on a cruise ship.
As the virus spreads across the U.S., the governor of Washington state, the hardest hit in the country, says the state is planning on enforcing stricter measures to combat the virus.
We are looking at extending what are voluntary decisions right now, and we've asked a whole host of communities to consider whether you really need to have your events right now, and they are being canceled. Comic-Con's been postponed. We have a number of school closures. We are contemplating some next steps, particularly to protect our vulnerable populations in our nursing homes and like, and we are looking to determine whether mandatory measures are required.
For more about the latest situation, both inside the United States and on board that cruise ship, we talk about the Grand Princess. In Washington, we are joined by Dr. Kate Tulenko, who is the CEO of Corvus Health. That is a global health advisory firm. She's also well recognized worldwide in health workforce and systems. In Atlanta, we are joined by Chen Zhuo, an associate professor of Department of Health Policy and Management from University of Georgia. He's also earlier was senior health economist with the U.S. CDC. Ladies and gentlemen, welcome to our program. Let me go to you first, Dr. Tulenko, about the latest plan for Grand Princess. What lessons can be learned from earlier Diamond Princess? Will lessons be repeated?
Yes, I think that's what they're trying to do, and what has caused some of the delay is they're trying to do things differently than the Diamond Princess. In the Diamond Princess, they quarantined people on the ship, and it's actually believed that some people got the infection while they were in quarantine. Whereas with the Grand Princess, they're going to remove everyone from the ship and keep them in quarantine off the ship. Another mistake that was made in the Diamond Princess is they had staff members taking care of the passengers, and these staff members were sharing a communal mess hall. sleeping in bunk rooms, and many of them got sick, and so it's believed that they spread the coronavirus. And so in this land-based quarantine, we'll have healthy people taking care of them.
Right. Just to follow up, if I can, Dr. Tulenko, one of the things is that many of those on board actually have already left. They disembarked, and they also already mixed up with their own community before this eventual decision was being made. And the other thing is the crew are still going to be on the ship, which means whoever got infected will still be there, because we know there's a long incubation process for the virus, could be 7 to 14 days even. So are we really sure whether we are doing the utmost to reduce the risks? Will those people who have already left the ship be able to be tracked down, as well as those who are in close contact with them?
So people who already left, they can be traced through the ship manifest, and that will be a state-by-state decision as far as what the states do. And as far as the crew on board, I think because they'll be quarantined on board, that will be a safe situation for them. And as far as, where people are being quarantined, the base that they're disembarking in is one of the largest naval bases in the world, and so there's plenty of space to move people around safely.
Let me go to you, Mr. Chen, also about that. I noticed that in Dr. Tulenko's answers, there have been a lot of indication about what would happen at the local level. Now, we understand the U.S. system at the federal level, at the state level, quite different. But how will this time things likely to work out? Because things are happening very fast, and decisions have to be made decisively, almost on the daily basis. So how would that work, Mr. Chen? Could you help us to understand?
Sure. It's a great question. Well, the U.S. system, the federal CDC actually does quarantine for those that cross borders, cross national borders, and also cross state borders. So there is a division of labor. Federal authority has the enumerated power, which means that the list on the Constitution regarding public health, and the states, it's the states that are frontline soldiers. They are doing the tracing of patients, the isolation and quarantine of these that might be in close contact. This does require a coordination between federal authorities, CDC, and also the state health departments, and in some cases it could be a county health departments. I think there is going to be a lot of work needs to be done on this.
I want to come back to you, Dr. Tulenko. Is that the situation now? Do you see there is much link being smoothed up among all of these players, or there is still quite some things that needs to be done?
We definitely need more consistent communications between the federal level, the CDC, and the states. There's no doubt about that. And we've already had some states really trying to take the lead in declaring a state of emergency. By doing this, this enables them to free funds, and also it often smooths the procurement process so that they can hire people faster, buy goods faster. It also can allow them to mobilize the National Guard. And we also have seen a city declaring an emergency, the city of Austin in Texas declared an emergency. And so we'll see different actors starting to come and play here.
The reason I asked this question also has a lot to do with what's going on with the very controversial issue of test kits. Now, we understand about that, the test. Once again, it's about federal level, national CDC, local level, even going to the private and public hospitals. What will they do together? So how is that working out also regarding this link among the different players? Dr. Tulenko and then Mr. Chen. Dr. Tulenko first.
Yes. So the federal government is giving more hospitals permission to do their own testing, and also they're making more test kits available, but clearly there aren't enough available. When you look at South Korea, which is a much smaller country, they've already tested 140,000 people, whereas the U.S. has tested less than 2,000 people. So we really need to ramp up the amount of testing. And another thing I want to call attention to is the fact that there's actually not only a shortage of clinical health workers in the U.S., but of public health workers. At the state level, there's 20% vacancies in public health jobs. These are exactly the type of people who would respond to emergencies like these.
Yeah. Mr. Chen, now that thing is bothering every country, I think, when it comes to speed and early response. Mr. Chen, China also at the very beginning of this outbreak, when the outbreak was being publicly announced, was the local level was struggling to deal with the emergencies after emergencies, but later, of course, things calmed down. But at the very beginning, there's always something that is not clear. So now, what would you advise, sir, you and also Dr. Tulenko, about how to smooth up? Because everything is happening fast, and it's lives, it's really real lives that we're talking about here.
I think there should be more planning in place. The U.S. System does have a preparedness planning and going on at different levels. CDC, the Department of Health and Human Services, and also state level. These plans tend to be very detailed. That could help in such situations. But of course, in the United States, state and local geographics, they may have a very different situation, very different capacity. As Dr. Tulenko was suggesting, that the state, the state public health workforce has experienced funding loss because our funding was gone, and the funding from public health and prevention and public health funds has always been at risk. So there are a lot of issues, and I think the state health departments needs to build up capacity.
Now,
and I think in China probably it's the same as well.
Mr. Chen, since you worked earlier as a senior health economist with the U.S. CDC, you probably know how money is being spread around on some of these emergency projects. So who will fund what? What's going to be the role of the federal level CDC and state level? And meanwhile, what would the other social, societal organizations, as well as the other sectors, such as the private sectors, what will be the roles of this, including insurance companies? This is, have they worked out so far, or this is still a murky water we're talking about?
That's a very good question. For me, I was a health economist, so I do not work directly on emergency preparedness. But what I have seen is that the U.S. CDC does have funding. Well, the Congress allocates funds to U.S. CDC, and then U.S. CDC sends the funds to local health departments, state health departments, and even in some cases hospitals and community organizations to build up a capacity via grants, cooperative agreements, and sometimes contracts. So it's a passing through. The CDC is a passing through agency. They fund the local organizations by the funded by the Congress.
Yeah.
In terms of coordination with the private sector and the local agencies, I think it does require a what they call health in all policies. And in the ACA, Affordable Care Act, there is an initiative to establish a national prevention strategy which focus on coordinating all different partners, private, public, hospital, and disease prevention and other sectors to work on improving health and to prevent such an epidemic.
Yeah, interesting. Very interesting
so
issue.
That's, I think.
Very interesting issue there. I want to follow up our conversation by asking Dr. Tulenko. We understand how this virus works now. It's very easily spread to all age groups, and all people could be vulnerable to it. So it's about case until it's clusters. And the clusters until it's community, and then boom. you have got the epidemic. So from your perspective, where is the U.S. now? Will containment still work, or there has to be very severe mitigation, as they say? Explain to us.
Well, the U.S. does appear to be in a situation where we have consistent community-based spreading. And in fact, many people are saying that already there's globally a pandemic because you have consistent community spreading, in Asia, Europe, and North America. So that's probably going to be debated for a while. WHO has not declared a pandemic yet. But I think as far as the U.S., we have a choice to make now. When you look at what China did and how they reacted, they had only one city, like Wuhan. And we right now have one city like Seattle. So we can make a decision to take measures now and contain things, or we'll end up with a dozen Wuhans, end up with a dozen Seattles. I think that if measures are taken now, it still can be contained. But we do need to not just suggest limiting of schools or businesses, but to require it. Because the just suggesting really doesn't seem to be working. We've heard reports of a healthcare worker told to stay home actually went to an event. A family told to stay home went to a public dance. So really, there does need to be more enforcement.
So you are saying, the containment process, probably we should call it off. Rather, it is about mitigation, which is a word, I guess, used by your community, health community, by suggesting that there has to be enforcement of social distancing and more efforts being made than just voluntary social distancing. Dr. Tolento, is that what you meant?
So I think it still can be contained. I think it's not too late for that, but that we do need to take measures. And I think we are seeing the states step up. And in Seattle and Kings County, they've closed schools, and they say the next 2 days they're going to take a few more measures. So we'll sort of watch that space and see what happens. But I think you'll start to see actual new laws or new regulations being passed to help contain this.
What kind of new laws, what kind of new regulations? Would you give us some hint about what likely to be the direction of these?
So most likely what you'll see is the limiting of public gatherings, saying, for example, no more than 20 people in a public gathering. So that would, cancel concerts and events, conferences, meetings. You might also see more schools closed. It's those big congregations that are the challenge.
But, if I could just follow up, it's the election year, a lot of political gatherings. And in the states of Washington, for example, there's likely to be local election about the Democrat nominee, right? So how is this likely to work out with the calendar? It sounds very complicated, Dr. Tolento. And then I go to Mr. Chen. Dr. Tolento.
Yes, it's certainly a very complex issue. And it remains to see how the voters decide as far as who they think handled this well and who they think handled it not as well. And that will be up to the voters to decide.
Right. It's a complicated issue in a complicated year. Mr. Chen, another question for you, also about whether it's voluntary containment or has to be mitigation now. The state of Washington, the state of California, and also the city of New York. Obviously, these three places have been more under pressure of COVID-19. But it doesn't mean the others do not, because we just do not know whether many cases have been tested to know whether there is big pressure. So, Mr. Chen, from your perspective, how will these states react? Will that be an example for the other states in the United States? Will that lessons and experience be learned fast? Are they listening also to the other things coming from different parts of the world, like from China, from South Korea?
A great question. I think the state of Washington actually is learning from the experience of South Korea. The University of Washington has opened a drive-through testing lane so that they can test the drivers with symptoms and provide, well, at this time it's a rather limited population. I think it's the University of Washington employees. But if the states and the federal authority can help to open this to a large population, I think that might help to contain the epidemic. And the other development is that the Gates Foundation, the Gates actually they developed testing kits that can be available quickly and well, have the results in 2 or 3 days. I think that's probably also help. Engaging private sector, I think that will help to contain the epidemic.
Dr. Tulenko, that's a beautiful question. In fact, what Mr. Chen just mentioned, Gates Foundation, for example, is one of those organizations that's really widely respected. However, one cannot depend on an organization to do this work, which should be implemented at different levels. And I understand it's about University of Washington with, you know, flu tests earlier, which could help with the test kits being developed. And but the thing is, Dr. Tulenko, do we know much about real measures that should be done on a national level and a plan that we have to see that the public in the U.S. will be better informed and protected? I'm asking this is because China also earlier have learned a lesson of having an important and clear plan and do it quickly.
Yeah, so there actually is a part of medicine called mass gathering medicine, and so there's been lots of studies on how disease spreads through large groups, and also certainly the SARS and MERS outbreaks have been studied. So there's a lot that we know about it. So we can certainly design evidence-based responses, and that's a lot of what the CDC and the states have been trying to do. I just think that the messages need to be given more strongly so that people take them more seriously. Also, we need our leaders to lead by example. You know, we need to see our political leaders, you know, doing elbow bumps and namastes, you know, rather than handshakes. We need to have people tweeting, you know, staying at home and that, you know, and saying, I canceled this trip, I canceled this meeting because I'm staying at home to practice social distancing. We need people to lead by example that way.
Interesting about this.
And also just from a
Go ahead.
Oh, yes, yeah. But another perspective is that, in my opinion, every single patient with respiratory symptoms needs to be treated as though they have coronavirus and needs to be tested for the coronavirus, because that's not happening now. There's such a limited number of cases that only the severely ill or only people with history of travel are being tested. So we have to dramatically expand the testing and also protect healthcare workers so that they have the equipment they need when they encounter a patient with respiratory symptoms.
I would love to have our conversation continue because a lot of important points both of you have put out there. Unfortunately, we're running out of time. We hope things are going to smooth up. We hope lives will be saved. Thank you so much for both of you sharing your insights. Kate Tulenko and Chen Zhuo. Really appreciate both of you. Thank you.